Helicobacter pylori. Helicobacter pylori is a gram-negative bacterium that persistently colonizes the human stomach. It remains one of the most common worldwide human infections associated with upper gastrointestinal conditions. These include peptic ulcer disease, chronic gastritis, and even gastric malignancies. It was identified in 1982 by Australian scientists Barry Marshall and Robin Warren. Marshall drank a culture containing Helicobacter pylori to prove that gastric ulcer is caused by bacteria. Properties of the organism. Helicobacter pylori is a gram-negative slow-growing bacilli. They are microaerophilic. They are highly motile with a corkscrew movement due to multiple Lophotrechus flagella. They are fastidious organisms found in an acidic environment. The prevalence of Helicobacter pylori colonization varies considerably among different populations around the world. It is dependent on age and socioeconomic development. Risk factors for Helicobacter pylori infections include socioeconomic status such as overcrowding, poor hygiene, and poor sanitation. Routes of transmission include, firstly, fecal-oral route, ingestion of stool containing the organism through contaminated food, water, and poor hygiene. The prevalence is higher among people with poor sanitary conditions like in crowded living spaces. Secondly, oral route. The organism can be found in dental plaque and saliva. It can be gotten by direct contact with an infected person, for example, sharing utensils or personal items. Thirdly, it can be an iatrogenic infection from contaminated endoscopes and other gastric devices. Helicobacter pylori is able to survive and multiply in the acidic gastric environment, which is hostile to most bacteria. Some of its characteristics that permit gastric colonization include 1. Microaerophilism. This serves for survival within the mucus gel in the stomach. 2. Spiral shape. This enhances colonization and corkscrew penetration of dense mucin covering the organ. 3. Flagella. Possession of flagella aids motility within the viscous layer. 4. Urease activity. This generates ammonium that buffers gastric acidity. Ammonia produced by urease may potentiate neutrophil-induced mucosal injury. Helicobacter pylori overlies only gastric-type epithelial cells. Affected gastric epithelium may be in the gastric antrum or fundus or may be ectopic in the duodenum or in the esophagus. The virulence factors for bacterial colonization include BABA, SABA, OIPA, and HOPC. The virulence factors necessary for gastric pathogenicity include the effector proteins like CAGA, VACA, TRA, and the outer membrane vesicles. For the development of peptic ulcer disease, the organism penetrates the mucus layer and adheres to the surface of gastric epithelial cells. It then produces ammonia, which neutralizes gastric acid. This leads to proliferation, migration, and formation of infectious focus. The gastric ulcer develops following destruction of mucosa and inflammation. Clinical features may be asymptomatic in about 80% of affected individuals. Some individuals present with symptoms of gastritis, which include abdominal pain, nausea, vomiting, and unexplained weight loss. Other symptoms include easy satiety, burping, and hypochlorhydria causing indigestion and impaired absorption of nutrients. Helicobacter pylori is associated with gastric and duodenal ulcer, GERD, which is gastroesophageal reflux disease, MALT, which is mucosa-associated lymphoid tissue lymphoma, and adenocarcinoma of the esophagus and stomach. Biochemical characteristics include urease positive, oxidase positive, catalase positive, and hydrogen sulfide production positive. The goal of Helicobacter pylori treatment is to eradicate the bacteria and reduce the risk of associated complications. It involves the use of antibiotics and acid-suppressing medications.
If you found this helpful, make sure to like, share, and subscribe, and I'll see you in the next video.